Good morning, and thank you everyone for tuning in today. I'd like to begin by advising our media partners that next week's media briefing will go back to its regular scheduled time of 4 p.m. on Monday, November the 30th. And of course, tonight is our COVID-19 virtual town hall beginning at 7 p.m. on Cable 14. So please tune in with any questions you might have. Tonight's theme will be enforcement and regulations in the red zone. And in addition to having our usual guests, Dr. Elizabeth Richardson and Paul Johnson, our manager of licensing, Monica Cirillo, will be joining us as well. So you can submit your questions for the town hall by tagging @City of Hamilton on Twitter, or sending an email to communications@hamilton.ca, and or by phone during the show at 905-645-3232. And I look forward to hearing from the community and answering any questions you might have during this difficult time. And again, thanks to Cable 14 and CHML for carrying these town halls. So in terms of city updates, shop local Black Friday with the holidays upon us and Black Friday taking place tomorrow. I urge people to avoid those large gatherings by shopping online to your favorite local retailers as much as possible. We don't need the big crush of people, and eliminating the physical separation and potentially continuing with the spread of this virus. So please do your best to use the curbside pickup or delivery options that many stores have right now in terms of their online sales. And clearly, this is not the year to be lining up for door crasher deals. So please use your judgment to avoid those kinds of circumstances. If there's too many people there, just don't go there, go somewhere else, or go online. So let's continue to support our local businesses, however. And if you're in a neighboring community and currently in lockdown, please do not come to Hamilton to visit our stores. Stay home and shop online, as we're recommending our own residents do. We don't need a crush of people coming in from, other communities to potentially spread what might have been there into Hamilton and adding to our community spread numbers. So we love our neighbors in Toronto and Peel. We don't want to see any harm come to you. We support the work that you're doing to try to stop the spread of this virus, but we do appreciate you staying in your community and staying home as much as possible, like we're recommending here. And I know that the recommendations in Toronto, Peel, and in all the other GTHA communities are virtually the same as stay home as much as possible, only go out for essentials. And in terms of shopping, online, wherever you can, is probably the best option, and curbside pickup is available to you. A reminder that Hamilton remains in the red category in order to protect the health and well-being of everyone in our community. And while we're in the red category, it is important that we behave in a way that will ensure we don't end up having to implement additional restrictions. So we don't want to go into lockdown. And as Dr. Richardson always reminds us, everyone in our community must continue to follow the advice from our public health team. What's that advice? Restrict your close contacts to your household members and essential supports. For those that live alone, you may join with another household for support. All in-person activities should be limited outside of the home to essential activities only. This includes work, school, fitness and exercise, access to health care, and the purchase of food or drink, gasoline, or automobile maintenance. And restrict all social gatherings to only immediate household members. And of course, wearing a mask or face covering when around others from other households, out in public places or outdoors when unable to stay physically distant, is extremely important and is one of the largest things you can do to help avoid the spread. And of course, lastly, washing your hands as much as possible to avoid any hand contact with surfaces or your face and mouth in terms of potentially bringing that into your system. So remember that red is just one step away from a full lockdown. And as much as we commiserate with our friends in Toronto, Peel, Mississauga, Brampton for their complete lockdown, we certainly don't want that to happen here. And we can avoid that if we can keep the spread of the virus at a minimum. So please do your part and follow those regulations. I'll pass it over to our Emergency Operations Center Director now, Paul Johnson.
Thank you very much, Mr. Mayor. And from my perspective this morning, just one piece that I wanted to highlight, and that has to do with mask wearing on our transit system. So just some things from HSR. But before I get there, obviously from an EOC perspective, we are answering a number of questions from the community, as well as ensuring that our own programs that are city delivered comply with all of the orders and all of the restrictions in our red control category. And I think it's important to remember as people try and understand those, but also sometimes say, how could we maybe maneuver around them a little bit, that this is to control the spread of coronavirus. And as such, these limits are going to be adhered to. This is not about finding ways that we can do more. This is about finding ways that we can do what we need to do to lower the numbers and to get ourselves back into the colors that allow more activities to happen. So in terms of adding more activities, you're unlikely to see that happen from a city perspective. We are going to keep ourselves operating as few services as we can in terms of those that gather people together. But on a day-by-day basis, all of the city services that are required to maintain the good operation of our community continue unabated as they have throughout this crisis. So from an HSR perspective, just a couple of reminders that we are operating at full capacity on our buses, and because of the masking approach that's in place, this is the best way to protect yourself and also protect others, is to ensure that you're wearing your mask and wearing it properly when you're on our HSR buses. So all of those criteria that we talk about the snug fitting, making sure it covers your nose and your mouth, not wearing it on your chin and things like that. Please comply with how to wear a mask when you're on the bus. We notice that everybody, our compliance rate on transit is very, very good. But what our drivers are feeding back and our surveillance is indicating is that not always are the masks being worn properly. And so we'd encourage people to do that. I'd also encourage people not to eat or drink on the bus. It is an exception that you can remove your mask when you eat or drink. So I'd ask you to consider not having that on the bus so that you can remain masked through the entire journey, because we want you to keep that mask on for the entire journey. At times, the buses are at their capacity limit, and there is obviously not a 2-meter separation between people on our transit. So the less opportunity for the removal of the mask, the better. And I know sometimes people bring on a coffee or like to have a quick snack. We'd ask you to consider doing that once you leave the bus and get on with the rest of your day. And finally, an exception to the mask wearing is not to talk on your cell phone. So there is no exception to remove the mask to talk on the cell phone. That's happening at times on our buses as well. And we'd appreciate that you can talk through a mask. It does allow for that communication to happen. So help our transit out, help the fellow users of transit out, and we'll all ensure that we can keep our transit system operating as it has throughout this pandemic. And again, want to thank all of our transit operators and the management and those that keep our buses on the road, doing a great job making sure our community can continue to move around for all of the things that people need to do. That's it for me, and I'll turn things over to Dr. Richardson.
Thanks very much, Paul. So today we're meeting a little bit earlier than usual, so our final numbers are not available yet as of now. They will be posted later on today on the web, and so you can look forward to seeing those there, along with all the updates around the outbreaks. I will say that our numbers have continued to fluctuate right around that 50 per 100,000 per week mark, and which puts us solidly in the red zone. We had seen a little bit of decline towards the end of last week. That's come right back up, and we've been sitting around that 50 per 100,000 per week. So similarly on an outbreak front, while certainly some of them are resolving, we continue to have new outbreaks being declared each day. So that continues to be of concern. I do want to say, though, at the same time, a big thank you to the many, many Hamilton residents and those who work in our city. I appreciate just how hard this pandemic has been and will continue to be for everyone. There's no doubt that this isn't going to end, in the next couple of weeks. As I said, we're solidly there in the red or control zone. And we're going to be living in this for some time yet to come. That said, there has been definitely a noticeable effort by many to follow the public health measures, to keep physically apart from family and friends, and to wear your masks. And I can appreciate how hard it's been to change the routine and what it means for all of us in our ongoing lives. The COVID-19 fatigue, as it's called, is definitely real. 8 months into this, people are tired. 8 months, actually, it's just 8 months for Hamilton, but that is longer when we look at the bigger picture, that people are tired of their lives being different and disrupted, and it seems like there is no end in sight. And I can assure you that my colleagues in public health services, and I'm sure in many organizations and businesses across the city and across the country, feel the same way too. We do have hope on the horizon with the COVID-19 vaccine that has been announced, and the province and the federal government are busy putting together plans in terms of purchasing vaccine, organizing how it's going to be delivered, and the logistics behind it, given just how complicated it is right now with the vaccines that we have. And so it's going to be a ways to go before that vaccine is really going to be available to all of us and able to see what difference that it makes. So we do need to look at how we can continue to cope and be resilient for the long haul that is ahead. And it's going to be particularly challenging over the next few weeks and months as the holidays can continue to come through, and with winter on its way. And so, we'd typically be out visiting with friends, having parties, and it is going to look different. And in fact, it's imperative that it looks different this year. And so we all need to look at how we can find new ways to celebrate the holiday season, that, celebrate in person with those who live in our immediate household, to celebrate virtually, and to focus on keeping our family and friends that we normally visit safe by staying apart. So we need to focus on how we get through the time together, how we do this as a community, the objectives we're trying to reach in keeping ourselves healthy, our family and friends healthy, the people who are most vulnerable in our society healthy, how we keep our kids in school, and stay safe together. So we know that the province did release some guidelines around holiday celebrations. And we're going to be updating our guidance around holiday celebrations as well as we go forward. And each day as we go through this, we do each have an opportunity to make a difference in the local fight to prevent the spread of COVID-19. We have the choice to stay at home unless it's essential that we leave. We have the choice to wash our hands. We have the choice to wear our masks and wear them well. I do have to say, I often see the masks down here, and they need to go all the way, covering nose, mouth, and chin. And the ability as well to restrict our gatherings and find new and creative ways to do the things that we need to do. It's going to influence our situation here in Hamilton and the situation more broadly as we do that. Thanks very much, and over back to you, Mr. Mayor.
Thank you very much, Doctor, and Paul, for your input. And as the doctor has pointed out, what happens next is really in the hands of all of us, individually and collectively. So you have a responsibility to do everything you should be doing or being asked to do to help avoid the spread of this virus in our community. And some folks in our community are still not getting it. So let me just refresh in terms of the fact that this can infect anyone. You don't have to have symptoms. You might be carrying the virus, and you can spread it to anyone unwittingly or otherwise. And so your protections are going to be important. It doesn't discriminate between age, gender, or demographics. And those, of course, that are especially at risk that we know now are seniors and those with underlying health issues, anyone with underlying health issues. If we overrun our healthcare system because we aren't following the advice of our public health experts, the choices could possibly be made as to who gets care and who doesn't. And that is a scary thought, and we don't want to even get there or even close to that. So we want to be able to keep the numbers down so that we can prevent any kinds of bad public health outcomes to that degree. And certainly we commiserate with the 71 plus, I think it's 71 at this point, Doctor, of folks that have passed away as a result of the virus, and the many people that have been affected by it, that have gotten ill and have latent issues as a result of the virus. This is not a one and done for a lot of people, and so this is also spreading to people and giving them potentially lifelong health determinants that are not positive. So prevention is everything right now. And yes, we know it's frustrating, and we know there's fatigue. We don't have many options, unfortunately, because that vaccine isn't there. And until it arrives in full force, that masking and these preventative measures are still going to be very much with us. So we need your continued hard work to prevent the spread of this transmission of COVID-19. And I know that the majority of our residents are doing that. And so let's just keep doing it. Thank you for all of your effort. And let's do our very, very best to ensure that we're protecting all the vulnerable people and supporting our healthcare workers. And when I hear complaints about wearing masks, and of late I've had to wear the mask most of the day, I'm loath to complain about it because I know that healthcare workers and grocery workers and frontline first responders have to wear these masks day in and day out. And they are at risk potentially, much more so than those of us that are staying home or staying sheltered away from people to protect ourselves and others. And so thank you for all of those frontline healthcare workers, all of those frontline essential support first responders. They're working hard under very difficult circumstances to help all of us get through this pandemic. On that note, Jasmine, I'm going to turn it back to you for some media questions.
Great, thank you, Mr. Mayor. As usual, we'll start with one question and one follow-up for everybody. First question goes to Dan Takema from CBC Hamilton. So Dan, you can go ahead.
Hey there, thanks for taking the question. This is probably Dr. Richardson. So there was quite a long wait yesterday to get the updated numbers on the city's website. We heard from Public Health that there was an issue with the provincial database, and I'm seeing Halton has shared a similar kind of explanation on their website, and they are anticipating a kind of a jump in cases because some cases didn't enter the system. So I'm wondering if Hamilton should be bracing for a similar kind of leap in numbers today, and if you can give me an idea of what the issue was and what we should be expecting today.
Yeah, sure. Thanks, Dan. We did see with the province earlier this week where they had some challenges in terms of the timing of pulling off numbers, and our staff, with our numbers continuing to be high, there's a lot of pressure on our staff, both in terms of, the number of cases to get through, but also we do data quality assurance on a regular, like every day with every case to make sure that they're all going in correctly. So for us here in Hamilton, it was our staff actually being very, very diligent and wanting to double check some things. And there were no errors ultimately that were there. They just were wanting to see that it was done appropriately. I don't have the final numbers yet for today, but I can tell you that based on the information that we do get before the epidemiologists pull it all together, that our numbers are still going to be quite high, and we'll have the specifics for them later on today. They're certainly not going to be down at a lower count from what we're seeing so far.
Okay, and then just to follow up on that, I guess you talked about us being solidly in that red zone and how the numbers have fluctuated. So can you talk to me about what you're seeing, and I guess how you anticipate, and what you anticipate is kind of causing the numbers to fluctuate and continue to be so high?
So in terms of the numbers, when I'm saying they're fluctuating, they're just fluctuating slightly around that level of about 50 per 100,000. And so we're not seeing substantial movement either way. I mean, the good news is we haven't seen substantial movement in terms of case numbers worsening. The bad news is we haven't seen substantial improvement in case numbers getting better. And, if we're going to move forward to reduce transmission, we do need to see that people are making changes and that things get better. We continue to see that, there are people who are not staying home when they're sick, that there are people who are not wearing their masks. There are people who are socializing, and that's the reason for transmission for the majority of our cases. They're either close contacts of cases that live in the same household, or they're people who have been socializing or not following the public health measures that need to be there. We certainly have a number that are associated with outbreaks, and those outbreaks usually start for those same sort of reasons where there's been some slip. This is a virus that requires us to be very tight in terms of following those measures. And when we're not, the spread continues and the numbers go back up. So we will be watching in sort of 2-week increments in terms of where the data is going. But right now the data is just staying solidly there around 50 per 100,000 per week.
Thanks, Dr. Richardson. Next question will be to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much for taking my questions. I'm wondering, with the message that the mayor is sending, that people from other regions shouldn't be coming here, to go shopping or whatnot. Is this is Hamilton seeing or hearing reports of people from outside regions coming in at all? And is there any way to actually stop people from coming in?
Directed to Doctor. So I'd ask the same question of Dr. Elizabeth a little earlier. So I'll turn it over to her.
Sorry, Katrina, I thought you directed it to the mayor. I misunderstood. In terms of, what we're hearing, I can't tell you that that I'm hearing stories around Hamilton per se. I am hearing from my colleagues that surround the lockdown areas that they are seeing those issues. And we've seen them as we've gone through this, where when there's control measures put in place, that the neighboring jurisdictions have challenges with either sports teams trying to move out and have their games elsewhere, dining spots, restaurants and whatnot being booked up, event spaces being booked up from people outside of those areas. So yes, it absolutely does happen. I don't have any idea of the magnitude here in Hamilton, but it is absolutely critical that we all get behind this and that we stay in the zones that we're in. Certainly there are going to be people who have to move. They're going to have to move across those zones because they're taking care of a loved one who's living on their own. They're going to have to move across those zones because they need to go to work and continue to provide for themselves and their family. But aside from that, when it comes to things that you can do in other ways, whether it's inside your own zone or you're looking at a store or a restaurant that you really like from outside the zone, you need to look at other ways to do things and to shop online, to do all the things that the mayor talked about earlier.
Thank you. And then my next question, in terms of the guidelines for celebrating the holidays, and even now with gathering with people from outside your immediate household, say in your own household, are these rules or recommendations, like, could people be fined over Christmas if, say, they gathered with fewer than 10 people in their household, but there were people from outside their immediate household?
So I'll start, and then I think Dr. Richardson can reinforce some of what we're asking for in terms of the advice. So right now, where we are in the red control, and again, our 28-day period will be reassessed prior to Christmas. But where we are today, if you have a social gathering indoors, the maximum number of people is 5. So obviously, if your household is more than 5, that's not a problem. But yes, the answer is there is a regulation from the province, indoor social gatherings or organized events. So even if a group wanted to organize a group of people to get together, if it's more than 5 people and it's indoors, there is that is part of the regulations, and there could be fines levied against people for having those. If it's outdoors, it is a limit of 25. And so those are actual rules that are in place. So those would cover the size of the gathering. In terms of a regulation that says you have to demonstrate that you are only with people in your immediate household, there is no regulation around that. But I'll let Dr. Richardson talk about, why the advice in terms of this household rule.
Thanks, Paul. And I think this is, we've talked about this in the past too, where yes, there's rules and there's rules that are regulatory. They're going to lead to fines, and our municipal law enforcement colleagues are out there enforcing them, amongst others. The bottom line is we each have to figure out how we're going to live in these times. And the advice that's out there is there to protect all of us. And so it's critically important, as I've said many, many times, whether it's to protect our own health or the health of our loved ones, to keep our economy going so our businesses can get back and up and running by bringing the numbers down out of this control area. We need to find ways to follow the advice that is out there, to find ways to live within the reality of a COVID world. And so I would really encourage people to be looking at those and looking at what they can do and do differently. I mean, that's the core of resilience, is understanding, what is in front of us and how can we survive and thrive in that environment. And that's what we really need people to do.
Great, thanks, Dr. Richardson. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions today. This question is for Dr. Richardson. At least I think it is for Dr. Richardson. We are hearing extremely disturbing accounts the final days of Emerald Lodge. So what is being done to make sure that other homes that this operator has are not in the same position? Why is this operator even still allowed to have homes at all? And are there evacuation plans ready for those homes?
So I'm going to actually turn that to Paul, I think, to begin with this one.
So regular inspections are taking place within the homes that are there. You will have noticed that there was a public health order placed at Cathmar just recently, I think on November the 20th, to do with some of the issues around kitchen, I believe. So there are continuing to be inspections. I can tell you that none of the homes are in the position that they were, nor was Emerald prior to this receivership and prior to the, quite frankly, abdication of management and oversight responsibility. It deteriorated quite quickly. In terms of evacuation plans, I mean, the city of Hamilton has had to do this on occasion, and so there are always plans in place, as you saw happen, if we are called upon to do so. But our first goal always is to make sure that we can stabilize places and keep them. The challenge with these homes is there actually is a transition happening. So if these owners were firmly entrenched in saying we're operating and continue to operate, then maybe there might be some other approach the city would be taking. But we were notified that the sale is occurring and apparently occurring imminently of these facilities. So the actual current owners are trying to dispose of them. And so we're also trying to understand what that looks like and understand what the new ownership group, who they may be, and whether we have confidence that it could continue. But as you can see, we have not renewed licenses in certain cases. We have also not renewed subsidy agreements in certain cases. And so we continue to really work hard at making sure that there isn't an expectation that these homes can operate in the same way as they have been in the past. But we really need to watch what's happening with the sale. But I can tell you that the regularity of inspections is commensurate with our concern about the operation of these facilities. It occurs regularly. It involves both municipal law enforcement. It involves public health. It involves our housing staff who have a relationship around some of the subsidization of people who are in those homes. And it also includes the Retirement Home Regulatory Authority, who are sometimes involved because some of these homes are dually licensed as retirement homes as well as residential care facilities. And you will also note that on November the 3rd, a management order was issued for Cathmar. So there is, and there have been additional orders issued around the finances of these homes. So there are a number of things happening to look at this. And I would say that you haven't seen other types of movement because the fact the sale is occurring at the same time. And I know in talking to our colleagues at the RHRA, we're all trying to understand what that's going to look like moving forward.
Thanks very much for your answer to that. And I think this is for Dr. Richardson. As we're seeing spread in long-term care and a number of large outbreaks in long-term care, clearly whatever is in place is not totally working. So, are you pivoting direction at all? Is there something that you're doing to try and turn this around so that we don't continue to see this get worse in the second wave in long-term care?
Yeah, thanks, Joanna. And this is the kind of vulnerable populations that we're talking about, and who unfortunately have borne some of the highest prices for the COVID-19 pandemic. And so, we've done a lot of work, and we have a congregate settings table of the Hamilton COVID response table that comes together, brings hospitals, it brings the RHRA, as Paul was saying, it brings the Ministry of Long-Term Care, brings public health, it brings representatives from the homes themselves together to talk about how can we support these institutions well, so that they're in a proactive way, so that they're ready, so that they're doing all the screening, they're doing all the they have their PPE on hand, they have staffing in place, and I'll tell you, it's a system that's under a lot of stress. When it just comes to plain old staffing, that is a lot of stress, and that's why we have a long-term care home commission that's going on, that's looking at these issues. That's why you've seen the province trying to look at what they can do to change things, and you're seeing issues happening across the province when it comes to long-term care homes and those sorts of things. So certainly we've been out there doing some proactive work. We are finding that unfortunately they do, as I said earlier, you've got to be on this, in terms of a home and following infection prevention and control measures and ensuring they have staff there. It has to be very, very tight. And one operator said, they'd been through many flu outbreaks and thought they were well prepared because they'd successfully managed those. But the level of attention to detail that is required for COVID-19 is higher than they've ever seen. And so we are definitely, working with these operators to try and, address anything with them that they can. And unfortunately, in those unfortunate instances where there's not improvement, we do turn to using the powers that are available to us under the Health Protection Promotion Act and using orders such as the Section 22s and the Section 29.2s for management in the case of an outbreak. But also know that our colleagues at both the RHRA and the Ministry of Long-Term Care are looking at how they apply their powers as well. It does come back down to that our experience in these homes reflects our experience in the community. And so, there aren't, if we don't have the opportunities for people to get infected in the community, they're not going to bring it into long-term care and into congregate settings, and we're not going to see those outbreaks. So again, we each have a role to play each and every day in the choices that we make. Whether we work in those settings and are, as the mayor said, facing the difficult challenges of masking every day and all the things that the challenging work that they do, or we're people just living in the community, we need to get this virus under control for all of us.
Thanks, Dr. Richardson. Next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. I guess this first one would be for Paul Johnson. We've all heard about this restaurant in the Toronto area, the barbecue restaurant, that's kind of flagrantly not following the rules that are in place related to COVID-19. Just wondering how that kind of compares to Hamilton. I know we don't have anything that high profile, but ever since kind of the new policy about naming and shaming businesses that don't follow COVID-19 rules, what have you seen in terms of compliance?
So in terms of compliance, the vast majority of our businesses, restaurants or otherwise, comply the same way. The majority of our long-term care facilities and retirement homes and residential care facilities are managing their way through it. So across the board, we're seeing a broad compliance. So you have seen on our website, the numbers are small. I know when we first did this, I said, I hope I never see another name on that list. They're few and far between in terms of those that have been fined or charges laid. Nothing to the level of what seemed to be a very egregious situation in the Toronto area. I mean, I can't comment on how they're dealing with all of that, but I read the news reports with obviously a degree of interest. And so I think the message to our community, and particularly the business community who might be wondering about this, is know the rules, follow the rules, know that we are proactively inspecting as well as responding to complaints. And that we are there during the day and into the evening, and we are a 7-day-a-week operation in terms of a team of inspectors who are ready to go out and look at things under the various bylaws and orders that are there either provincially or locally. And I come back to what Dr. Richardson said. Most of these things are fairly straightforward to follow. We're in this groove now. We're 8.5 months in since Hamilton fired up its emergency operations center. So some of these things are pretty straightforward. And as I say, most businesses are doing very well under it. They understand it. They have not seen it impact. I mean, the numbers that they're required to now contain to is definitely impacting their business. But in terms of the requirements for contact tracing information, for having people wear masks, I mean, people are getting into that and they understand it and they're following that. And really what we're trying to do as a community is make sure that we can get back to a less restrictive piece, because I know the numbers are really hurting our restaurant business. But good news is that we have broad compliance with this. And I'm really proud of our officers for being out in the community and following up on the ones where there's obviously a lack of following of the rules. And we'll continue to do that throughout whatever level we're in and throughout this pandemic until all of those orders and all of those bylaws are rescinded and we can go back to life as usual.
Thanks very much. And I guess my second question would probably, probably be for you too, Paul. It's about the ongoing situation. There's a very, very high profile protest in front of City Hall about the situation. The encampments continue to exist in the city, whether or not, we try to house people in shelters. Just wondering what the city is seeing on that front, what's being done to kind of respond to the concerns of those who say there's just simply not enough shelter at this point.
So I can answer in terms of the homelessness, what we're doing around homelessness, and then I'll see if the mayor wants to also address the people that are gathered at outside of City Hall. But in terms of homelessness, we continue to move people into safe shelter. We continue to house people into permanent accommodations, and we continue to do outreach to those who are unsheltered and living rough in the community. Good news is the number of encampments has almost halved. We were over 20 at the height of working with encampments, and we're down to between 10 and 12 now that we're actively working with, and continue to move people into safe shelter each and every day. In fact, since this pandemic has begun, in terms of those who are sleeping rough in this community, we've moved 241 people into safe shelter. We have housed just over 50 people into permanent accommodations since April. So we continue to do our housing work. We continue to move people through the continuum of housing. And the other piece is we continue to monitor the numbers and have a strong backing from council to continue to expand our shelter and hotel system as necessary to move us through this pandemic, with a particular focus, obviously, we live in Canada, on the winter months where it becomes even more difficult for those who are living on the street. So I think our plan in terms of how we can offer shelter space to those who need it, it continues to be a strong plan from a infection prevention and control mechanism. We have all of those protections in place. We quickly isolate anyone who's showing symptoms of COVID-19. We have testing mechanisms in place, and should anybody test positive, we have an isolation shelter which is separate from the rest of the shelter system that people can go to. That has worked extremely well for us. And on the numbers, and I know people keep talking about, well, the numbers and our shelter system doesn't have enough spaces. And the answer is, yeah, we've known for years we need to expand the shelter system. But during this pandemic, we have expanded the shelter system quite a bit in order to accommodate that. We know we have to keep the physical separation. We know we have to offer not another mat on the floor in an existing shelter, but we need an additional space. And we also have to offer some spaces that we've, have had struggled with in the past, spaces for couples, for instance, that don't fit into maybe our traditional shelter system. And we've done that through hotels and some other activities. So we will continue to expand as necessary as those numbers dictate. And then the other piece is we continue to do our housing work and help people move through that continuum. And the last piece I'll say is that obviously we have an affordable housing crisis that's been named by council. It's a priority of council. Our staff are working each and every day, and there are little bits of good news that come on top of all of the other good work we're doing, like the Rapid Housing Initiative that we quickly approved through council in terms of receiving the money. And as I announced yesterday, we already have a few projects that are going to be able to get underway quickly, another 45 units of affordable housing. And we expect that number to grow to well over 100 through the Rapid Housing Initiative, through other funding that may be available. So we're doing everything we can. It doesn't diminish the fact that we need to keep working harder on it. But in terms of our work with the homeless population through this winter period and through this pandemic, I continue to see that our plan is solid, and the evidence is there in terms of the number of people we've been able to shelter and the way we've been able to deal with our infection prevention and control measures with this population. And Mr. Mayor, I'm not sure whether you wanted to make a comment or two about the protest.
Thank you. And yeah, we certainly consider it to be a protest, not an encampment. And the reality is that, people are free to protest, as many people do out in front of the City Hall forecourt, but they're not allowed to put up tents and encampments. And so notification will be going out today, I believe, to them to remove the tents. 25 people at a time can stay in the forecourt. The police and bylaw are there to ensure that the 25 provincial order in terms of gathering limits is adhered to for all the right reasons, and that physical distancing is also being adhered to out there in the forecourt. In terms of their demands, I mean, as Paul just laid out, out, housing has been a particular focus for us. I can't think of any other municipality that a couple of years ago, before this all started, identified some $50 million over 10 years for predominantly housing, poverty, and most of that money's gone to housing, whether it's on the Indigenous side, so 10 million has gone to the Indigenous community, 20 million to City Hamilton Housing to retrofit some derelict units that are now coming up into affordable renting opportunities that were formerly derelict, and another $20 million for projects that are happening throughout the city as we speak. And I think we talked about that yesterday at the council meeting. Paul outlined a whole host of projects that have been facilitated by the $50 million housing plan that we have put in place. So we're doing more than most municipalities. Is it enough? It's never enough. We need to do more, and the focus on that continues. In terms of the defunding the police, 50% defunding of police is not a rational notion. That's certainly not supported in the broader community, and that's certainly not where we're going. But we are having a conversation with major institutions and organizations in the city on the safety and wellness plan that's required by the province, which is really the process in which you define how you create a safer and more well community. And the police are participating in that and will continue to do so. And if a realignment of resources that helps improve outcomes for individuals in our community starts to happen, then the police are not going to be a barrier to that. So we'll continue to work with the group, actually headed up by Paul Johnson, facilitating this discussion. And hopefully out of that discussion at some point down the road, certainly not in this budget year, but possibly next, if there's an opportunity to improve outcomes for individuals in our community, whether it's mental health or addiction issues, all of which are being worked on by the city and police, if we can improve upon that, then we'll certainly be participants in that.
Great. Thank you, Mr. Mayor. That's the end of our media questions for today. So I will pass things back to you for some closing remarks.
All right. Thank you so much. And thank you to the media for participating. And of course, thank you to Bill Custers and the entire team at Cable 14 and Clear Cable to help us facilitate these gatherings smoothly. And of course, we ask our community to keep up the good work that you're doing to adhere to the public health measures. If you're sick, stay home, keep your distance from people you don't live with, and wear a mask indoors when maintaining physical distancing is a challenge. And of course, keep washing your hands and look after one another. And if you or someone you know would like more information on COVID-19 or our response and the response in the red zone, please visit our website at hamilton.ca/coronavirus. A lot of information is available there for individuals and businesses in our community. And just to put a point on the discussion early in terms of the impact on businesses, not only should they know what the rules and regulations are, but the resources that are available to them to help them get through this difficult time in terms of employees and businesses and individuals. So a lot of information is on the website. So go to hamilton.ca/coronavirus and you'll see it there. In the meantime, we can see you tonight at our town hall starting at 7 p.m. on Cable 14 and our next media advisory next Monday. Take care, everyone. Take care of one another. Be kind to one another. Be patient. Let's stay the course and do our best to stop the spread of this virus. Thank you.
Do you have feedback on Cable 14's programs? Let us know by calling 905-523-1414, extension 227, or email feedback@cable14.com.
On the next episode of Chamber TV, we sit down with the Hamilton Chamber staff for an update on federal and provincial subsidies and resources, as well as local initiatives that can support your